Today, I'm speaking with Syeda, a devoted sibling and steadfast advocate for her brother who passed away in 2022. A passionate advocate for equitable healthcare, Syeda is now an aspiring medical student, hoping one day to be a paediatric cardiologist.
Please voice out your struggles, advocate for yourself and your loved one at every step, no matter what, just like how I did for my brother. I like to believe that we together can make healthcare more equitable. We need to. There is no other way.
To begin, we'd like to acknowledge that this podcast is being recorded on Gadigal land in Warrung, otherwise known as Sydney. We acknowledge the traditional owners of this land and the land that you're listening in from today. We pay our respects to the elders, past, present and emerging, and pass that respect to any Aboriginal and Torres Strait Islander listeners.
Thank you so much for joining us. Where are you dialing in from?
Thank you. Well, I'm dialing from Melbourne, cold and wet Melbourne.
One of my friends just came back from Melbourne and she did say that it's slightly different to Sydney. So hopefully you've got some good heating. All right. Look, I guess some background for our listeners. So your youngest brother was born with a CHD in United Arab Emirates. I guess could you tell me a little bit about your brother and his heart condition and your experience whilst living there?
Sure. So my brother is the youngest of us four siblings. I'm the oldest and then a sister and two twin brothers. He is the youngest of a twin. And he was born with a rare form of congenital heart defect called as truncus arteriosus, which essentially in layman terms means that the pulmonary artery and the aorta was combined into one trunk. And he also had a VSD, which means there was a hole in between the right and the left sections of his heart in the septum. He was cyanotic, bluish in appearance, and he had very rapid heartbeats, very slower growth, and on top of that he also had spina bifida. That meant he was not able to walk, and his form of mobility was either by crawling or by using the wheelchair. My brother as a person, he resembled me more in looks, habits, and likes and dislikes, such that we would joke amongst ourselves that we were twins, just 8 years apart, because I was 8 years old when he was born. I clearly remember the day when me, my dad, and my late uncle, we went to the hospital a week later after he was born to get him home, because as soon as he was born, he was rushed to the NICU and for additional care and all that. So the minute I saw him, I told to myself, 8-year-old me told to myself that, hey, I don't know what's wrong with him or what his condition is, but I believe that if I play with him and if I give him all the love in the world, he is going to get better. So as a person, he was the doll of our house, being the youngest. Obviously, youngest siblings are the most favored. and he was a very understanding kid, very empathetic, someone who you could discuss things with. Even though we were 8 years apart, I would discuss my days often with him. And even when I moved here almost 5 years ago, there was never a day when he would not text me early in the morning, right after work, and then later at night, and tell me, hey, Api. Api is like Urdu for elder sister. And he'd be like, hey, Api, good morning. How are you doing? Did you wake up? Did you have a good breakfast? What did you have for breakfast with? And the same after work. How was your day? What do you do? Did you make lunch? You make dinner? What do you make? And all of that. And he was the most kindest, the most smartest, the most bravest kid I had the pleasure of and the privilege of knowing. And to talk about his smartness, he taught himself how to type and read on his own. He taught himself math solely by watching cricket. So yeah, that was like, he had amazing smartness in him, and which would even surprise a lot of people. So yeah, that was him in a nutshell. I mean, I can write it can go on forever and ever if I keep on talking about him, but yeah, that was him as a person, and he was my entire world. And our world, it gets very dark and dim at times. So he was the most brightest star in our too often dark and dim world.
Yeah. Tell me a little bit about losing him and what that process was like for you being, so close and having that such special relationship?
Yeah, it was very hard. It happened all of a sudden last year in May. He was admitted to the hospital for sepsis. He had a series of pneumonia occurrences early last year, and then in the third occurrence, it just aggravated to sepsis, and he was admitted. And then I had to fly out of here because I was not satisfied with the care given to him. And he was even telling me that, Api, come here. I need you to be here, because he told me if you're here, I can fight off any infection. So he had that blind sort of trust in me, that he believed that I won't do any wrong to him. And as a sibling and as someone who's not medically trained, well, yet it is both scary and is a privilege at the same time. I'm sorry, what was the question again?
That's okay. I guess, yeah, that losing him when you had that relationship.
Yeah, the losing him, when I received the phone call from my sister that morning, it was exactly 7:30 a.m. in the morning on Queen's birthday, and I did not believe it for a second. I remember myself telling my sister, please go and ask the doctors. There has to be a mistake. It can't be the reality. Maybe oxygen is there somewhere in his body. Ask them to apply defibrillators, ask them to look at every option. I'm pretty sure he's just joking around. He is alive, but yeah, it was very hard. And even I had to fly out to arrange all the funeral and the burial proceedings because I'm the eldest, and as the eldest sibling, you have a fair share of the responsibility of everything. And even then, even when I reached there, when we went to the morgue to see his body, I had that in my brain. He might just wake up. I'm a kind of person who has a very delayed response to grief and suffering, because I'm the kind of person, I'm like, okay, I'll deal with the situation at hand and I will worry about myself later. That is not the most healthy, but I guess it is what it is. And it was my way of dealing with the situation as best as I can. With grief, it did not hit me till I was back here a month later when I was seized with my parents. I always told myself that, hey, if I start crying now, uh, my parents would start crying and everyone else would start crying. And I did not want to do that because they already were. It is devastating losing your kid and your siblings. Siblings are a historian of your lives. They know you more than anyone else in the world, even better than your parents, because they see you grow up. They argue with you, they fight with you, they see your happiness, they see everything. And losing him meant I lost parts of my past, my current state, and parts of my future, because it's like there's always that hole and that can never be filled. And with grief, if I have to describe it, it is exactly like the number 8 inverted, where at the most center point, that is where the grief lies. And around it, you keep on encircling, and that's where the life builds slowly. So when I returned back a month later, it was very hard for me to cope with it. I would go to work just to get some sense of normalcy, but then, I mean, mentally, I was like, what exactly is going on? None of it makes sense. It wasn't until a year later, recently, that I actually went and got, because there were times when I just did not know what to do. I would cry, and even now, there never goes a day when I do not miss him. It's been extremely hard, and there never goes a day when I wish that he wasn't he. When I don't wish that he was here. When I wish that I could just talk to him once again, or do anything to do that, but I know it's not possible. And so it's just keeping his memories alive, talking about him. I love talking about him, and remembering his tiny jokes and bits and pieces of laughter. He had a habit of recording himself on the phone. So we have entire galleries of him on our phones. He even would record his voice and send voice messages. So it's all there. And so whenever I feel low, I just go and listen to them. And yeah, I do cry by listening to them, realizing that he's not there. But yeah, that's how I've been dealing. Another way I've been dealing is I talk to him every day, as insane as it sounds. I know he's not going to respond, but then voicing it out like, hey, this is what happened to my day. This is what I did. Did you see that? And, what do you think uh, would have been the best way forward and all of that? And another thing which I do is like, and this might sound bizarre again, but ever since he passed away, I've been seeing more and more people in wheelchairs, no matter where I would go. And that reminds me that he is around. And whenever I see someone in a wheelchair, I just smile. I was like, yeah, perhaps he's there, he's around, and he's watching.
Yeah, he's sending little messages to you. I suppose having, as you said before, when he said, can you come, can you look after? I can imagine, being the eldest sister, having all that responsibility. It's incredibly hard to, I suppose, accept that sometimes you don't have control or you can't do things in situations. What was it like, I guess, for you as like an advocate for him in situations where maybe you weren't able to control that for him? How did you show up in those spaces?
In those spaces, if I could not show up in person, I was advocating for him remotely. Yeah. So I had my younger sister go with him, and even my mom and dad go with him and report me on what exactly is going on. And even he would tell me almost every time, every 1 hour or every 30 minutes, that what's going on with his condition, what did the doctor say, what medications are being given to him. So like very early on, given that there was scarcity of information on, and to go back to your point on how the healthcare systems in the UAE, the best way to explain it would be it parallels the American healthcare system, where you have mandatory private health insurance. There's nothing called as Medicare in there. So essentially, your care depends upon how much you earn, and it is tied to your job. So for instance, if you do not earn well enough, you get the most basic tier of health insurance, which does not cover anything. It does not cover specialists. It does not cover anything called as congenital heart defects. And unfortunately, me and my family, we were in that level. I'm from a low socioeconomic background, so it was always that struggle of financial struggles. I can remember for as long as I've been around in this world, there was always financial struggles, and it was always having to choose between going to the hospital, going to the doctor, or paying your rent, or paying for food. And obviously, in those cases, you choose paying your rent, or you choose paying for food. That was the whole system in a nutshell. In my brother's case, though, when he was born in the year 2000, initially that cardiologist told us, yeah, he won't live if you take him out of the hospital. And then 6 months later, we had to rush to another hospital there, and then they told that unfortunately we don't have the technology to operate on him. The surgical advances are not available in here, so there's nothing we can do. We were literally left on our own devices, and there was no guidance or anything provided to us, or any sort of medications provided to him for the first 18 years of life on his heart. So I'd spend nights reading up on his condition and sort of relating, okay, this is what his heart is. It's not nuclear science. It's just different than my normal heart. And I would be walking alongside him at every appointment of his and explaining to the doctor that, okay, this is the condition, this is what's happening. So I took it upon myself to learn as much as I could about his condition and be that voice. The older I grew, the more I understood how the healthcare systems work, how much care he was not being given. And to be very honest with you, in his entire 22 years of his life, it was only 4 doctors who bothered to listen to his case and do something on managing his condition. We would be told that, sorry, he's a very risky case, we cannot do anything. And that would anger me, and that would make me very sad. I would just wish that I had more knowledge under my belt to help treat and manage his condition.
I think even like I'm a little bit like, I've never heard somebody say like, his heart isn't, there's nothing wrong with it, just works differently to mine. Like, I just think even that way of thinking, like, so incredible, just that situation moving. And I can imagine the more frustrated you got, the more you learnt. And
Yes.
yeah, I guess now when you had all of that knowledge in your brain and you were caring for him and like understanding his body and the way that he moved in the world, did that feel really empowering to have that?
It did. And with my brother, well, up until the age of 18, I would be advocating for him. He obviously, being the smart kid he was, he would watch me talk and he memorized all of it. So when I was here, he would do the talking, and then he would explain, and all the doctors would be shocked. They'd be like, "Where did you learn all this from?" He'd be like, "My sister." So, like, being from a culturally and linguistically diverse background, in addition to being from low SES, in such communities, congenital heart disease is totally unheard of. You don't have any such community. There isn't a directory like how HeartKids has now with all the specialists. So it was all really up to me to navigate, to find out doctors and specialists for him, and then motivate my parents that it's okay, do not stress, it's going to be fine, just keep going. If I have to explain it, it would be related and give an analogy. It'd be more like as though I was the driver of the ship and he was the captain, and I would be following his directions, noticing how his symptoms were, how he would be feeling, and then I would delegate to my siblings that, okay, do this, do that. And each time he'd be admitted to the hospital, we would delegate amongst our siblings and then tell my parents too that, yeah, okay, it's gonna be fine, don't stress, it's fine, it's all right. And we would take care of it that way, because for us and for me, the priority was always his healthcare, and I managed that alongside school, university, work.
I was going to say 8 years apart, so you're so young when all of this is happening, and it's been like such a, even like I think about in my family, I'm like, when I think about my journey, I'm like, it's not actually mine, like this is my whole family has this. What is it like for you to have this as part of your life, but then also have your life, and to balance all of these things? How have you been able to, I suppose, look after yourself whilst advocating at the same time? Has there been much space for that?
To be fair, not really. But the only thing that kept me going was his health, and then our socioeconomic condition. So obviously, I had to balance both side by side. I knew that if I would not get a degree, would not get a good job, obviously I would be stuck in that whole cycle of poverty. So I had to step up and do something about it to change our situation. So it was all about balancing things. It is hard, but I don't think I would have wanted it any other way. Like, if I had to go back, I'm pretty sure I'd have done it the same way.
That's the thing. I feel like a lot of the time, like, oh, do you think that this, like, you think things would be different? It's like,
Yeah.
well, I never really had the choice for it to be different. This is what it is.
Exactly. When you do not have a choice, all you see is, what can I do? It does not matter what it is, does not matter what it takes. I need to ensure that he is alive and safe. That was the thing.
Yeah, it's survival. Like, it's survival, and you find the joy in everything that you can.
Yeah. And at every time he'd be admitted to the hospital. I mean, yeah, hospitals are not really fun places to be in. They are unknowingly designed to be very annoying, with all those light bulbs, and where your privacy is just a blue curtain. In those moments, he would joke around, being my brother, and we would play. And as siblings, I think that was very important, like being there for him, even though there was no one else for us, even though we had to literally explain the entire healthcare system every time. That is what was happening with him, what sort of care we need, why we need the care, and give explanations at time. That can get very frustrating and very tiring. But the fact that we were with him, I think think, yeah, that's what mattered.
Your situation is obviously so unique. But I do want to talk about, I guess, when we come into these spaces, knowing the way that you've had to fight for your family, for, I suppose, people coming into this who are, when doctors tell you something where you're like, I know that that's wrong and I want you to dig harder. What is your advice for people who are in those situations where they're a little bit unsure and don't know how to advocate? How have you been able to do it?
Oh, yes, definitely. So, and that is quite common in people from, again, culturally and linguistically diverse backgrounds, because, hey, when you are talking to a healthcare professional who does not speak the same language as you, it becomes much more harder than anyone else, essentially, to explain what you're going through, or to explain what your loved one is going through, because there is that essential language gap. What I would say is seek a translator at every minute. And also, if you're not sure about something, ask questions. It is your right to ask questions. Healthcare is a human right, and you have equal rights to healthcare as the next person. If I have to quote the late Dr. Paul Farmer, who was a physician anthropologist, his quote goes like, the root cause of everything that's wrong with the world is that some lives are worth more than others. In reality, that should never have been the case. So if at any time you find yourself that you're confused about something, ask questions, tell the doctors to draw it out if needed. And if they are not explaining it to you, I would say seek second opinion.
Yeah, 100%. I think, like, in terms of standard of care, I think the systems are very much designed to put the onus on people coming in, whereas standards of care is anybody who comes in, no matter how they show up, they have care that's safe for the person.
Exactly. Yep.
Yes. Yeah. I know that we are getting some holistic standards of care that are coming in. I guess for you, in a holistic point of view, what are the priorities that you think are so important when people come into a hospital?
When people come into the hospital, essentially, they should not be discriminated against. They should not be discriminated based on their social status. That has to be the first one. Half the population of the world who could be the next surgeons, doctors, the brightest minds, they are dying because they do not have adequate access to healthcare. So ensure that the barriers to access to healthcare is eradicated. When they walk into the hospital, they should be asked that, okay, when was the last time you visited the hospital? How was your experience? Is there something we can do for you? Rather than being labeled just because they're not able to tell their histories properly, that, hey, he or she is a non-compliant patient or a difficult patient. No one is non-compliant or difficult. All you need to do is perhaps ask questions and understand.
Yeah, be a human. Yes. Look, I want to go back a little bit as well. I know that before we mentioned that, this experience is your story, it's who you are and the grief that you've had from that. I want to talk a little bit about, I guess, your life direction and what you're doing now, and I guess the influence of your brother on your life.
Right. Okay. That's a very interesting question. Well, currently I'm working as an electrical engineer with a consulting firm in Melbourne. I'm an engineer by background, and I have volunteered in the past with St. John's Ambulance, currently volunteering with HeartKids. And I got in touch with HeartKids right after my brother passed away because I really wanted to do something which would benefit families and kids like my brother and families like us. And it was the only thing I could find. And I'm really impressed with the work HeartKids do. My life direction, it would so whatever I've been doing ever since he passed away has been for him, and I literally look forward to contributing in the congenital heart defect space as an extension of my care towards him. Because the reality is, I've been caring for him for 22 years, and you can't just take that away. And there always is that gap. So the best way forward would definitely be to do something towards that space so that I keep continuing my care towards kids and families like him. And if my knowledge and skills can help lessen the confusion and the pain in one other family and in one other heart kid like my brother, then I would definitely consider it as a privilege and having lived life having lived a worthwhile life.
That's it. I think you're coming into this like not only with that lived experience that so many people don't have, but to have that knowledge. And that's the
Mhm.
thing. You knew what was going on when you're 8 years old. Like you've got years of this. You know
Yes.
this.
Yep.
Do you find that, I guess, as you're progressing along that progress to work in the CHD space, I know that sometimes when people tap into avenues where they have lived experience, they can feel really triggered. Do you
Mhm.
find it more healing than it is triggering? How is it feeling for you?
It is more healing. So for instance, when I read on things about blood pressure or heart or cardiovascular system or even inequities in healthcare, his face and his cute actions, it just comes in front of me. A part of me at times feels sad, but then a lot of me, it motivates me that no, I need to keep learning. I need to keep doing better so that one more life under my care does not face this.
100%. I love that. And I think looking back on your journey, and the barriers and the things that you've overcome and faced, um, I guess what's been the biggest thing that's resonated for you through this journey and that you would want people who are beginning that journey, having bubs with, similar conditions to know?
The biggest thing would really be take things one day at a time. And in this journey, if anything I've learned, and if anything, what me, my siblings, and family has learned, that everything was unknown because my brother was constantly being brushed with death. Because, hey, imagine the very thing that pumps blood to your entire body and essentially keeps you alive. That is the very thing which isn't working quite well, which is just different. And essentially, you are being brushed with that at every hospital admission. That it's filled with uncertainties, but the only thing that was known was us being by his side at every step of the way, and that meant the world to him. He dubbed me and his duo as the wise Dumbledore from Harry Potter. So I was the Dumbledore, and he named himself as Newt Scamander because he believed that with me by his side, he'd be able to fight off every infection, just like Dumbledore and Newt Scamander fought off the Death Eaters.
Love that. I think it's such a beautiful thing that, in the future you're going to be part of, other families and you're going to be doing the exact same thing. Like
Yep.
that's so beautiful. And look, like I gotta live it. I live it. That's so beautiful. I just don't think that I've ever really heard anyone say that, it's just different. It's not broken. It's not this. It's just different. And I think that
Exactly. And also I have like two other things to say. To my people from culturally and linguistically diverse backgrounds, I'm pretty sure it must be very, very difficult for them to explain what you, your siblings, or your loved ones is going through when you and the healthcare team do not speak the same language. I'm also aware that it gets often isolating to find a listening ear within your community and that is often due to lower health literacy, and hence my advice to them would be to keep on asking the doctors questions till you understand. There's no shame at all in asking them to draw pictures, to write down key points of you or your loved one's diagnosis and the next steps. Ask for a translator whenever needed. There's no shame at all. And unless and until you are empowered yourself, there's no one who's going to come and help you. And another point would be that to my people from low socioeconomic backgrounds, I am very aware how challenging it is to afford to live each day, let alone having to decide between paying rent, affording food, or going to the doctor. Sadly, I do not have a solution for it yet, but please voice out your struggles, advocate for yourself and your loved one at every step, no matter what, just like how I did for my brother. And I'd like to believe that we together can make healthcare more equitable. We need to. There is no other way.
I guess when you envision, if we look like 20 years, 30 years in the future, what is the system that you would like to see?
I would like to see the healthcare system, it needs to be fixed from the bottom. It needs to be torn down and rebuilt such that patients are at the center of healthcare. And we need to ensure that people from every background and not just the wealthy folks get access to healthcare. If I have to put my engineering hat on, why is it that there are so less healthcare services provided in rural areas? An easy solution to an engineer like me would first be infrastructure, provide more telecommunication networks so that doctors actually can go and live there and provide their services, increase more specialists in rural and remote regions, have more community-based clinics so that they are in touch with specialist hospitals, and a person's care, no matter where they are, can be accessible. I would also like to say that an inclusion of a module during medical school on congenital heart defects, so that budding medical students are aware it exists. It's nothing foreign, so that when they become doctors, they do not end up being like, sorry, it's too risky, we cannot deal with it. They're aware this is what happens, and let's dial up the specialists and as soon as possible. I'd like to see people being treated like people, and remembering that they have a story rather than just another paperwork or just another organ.
That's it. Yeah. It's a safe, accessible healthcare for every single person.
Exactly. Safe, accessible, because reality is healthcare is a human right.
100%. 100%. I love your brain. Love your brain.
Thank you.
Oh, beautiful. Look, they are all of my questions. I guess, is there anything else you'd like to note or you'd like to add?
I would love to say that to our heart kids and heart adults, you are much more than your unique conditions. Your resilience, your bravery, and patience is nothing less than admirable. And every day, it motivates people like me with a physiologically normal heart. I am rooting for you.
This podcast deals with some heavy things. If this brings up anything for you or somebody that you love, it's important to reach out for help. The HeartKids helpline provides support, advice, and guidance for people impacted by childhood heart disease. You can call the helpline on 1800 432 785. To access more information about childhood heart disease as well as support from HeartKids, visit the website heartkids.org.au. The information on this podcast is not a substitute for medical advice from your doctor or healthcare team. Always talk to your doctor about matters that affect your health or your family's health.